Thank you for that introduction. I'm excited to be here today to talk to you about ergonomics. It's a term that we've all heard, but not necessarily one we all understand. Maybe you've seen some weird looking products marketed as being ergonomic, some of which might actually live up to the hype. But what does the term ergonomic mean exactly? Well, ergonomics is the science of designing and arranging things so that people can interact with these things in the safest and most efficient ways possible. Basically, ergonomics is all about changing a task, process, or system to suit the capabilities of the person or the people involved. Often, people think of ergonomics in terms of the equipment used in their office. And while it's true, there are a lot of different examples of office equipment that is marketed as ergonomic, most notably your chair, that's not the only place where ergonomics is applied. In fact, the science of ergonomics can be applied everywhere that there's somebody doing something. Ergonomics has been described in healthcare and many other sorts of workplaces, in daycares, in how we move in our leisure time or around the house, in the use or design of assistive devices like canes and walkers, in rehabilitation settings, literally everywhere. There are even documented ergonomics considerations for kids and pets. So basically, the overarching goal of ergonomics is to reduce the risk for developing ergonomic injuries, which are also known as musculoskeletal disorders, or MSDs. The U.S. Department of Labor defines an MSD as an injury or disorder of the muscles, nerves, tendons, joints, cartilage, and/or spinal discs. Typically, when we're talking about MSDs or ergonomic injuries, we're talking about injuries that develop slowly over time. It doesn't usually include disorders or injuries caused by slips, trips, falls, motor vehicle accidents, or other similar one-off accidents. These MSDs that I'm referring to are also called repetitive strain injuries or occupational overuse injuries and things of that nature. The problem with using terminology like repetitive strain injury is that it implicates a single cause of damage to the musculoskeletal system, that being repetition. So this definition is limiting because more and more research is pointing to multiple risk factors that contribute to these MSDs. So what I like about the term MSD is that it accurately describes the problem. We know that these injuries reside within the musculoskeletal system, or the tissues of the muscles, bones, and joints. So this is the term that we use most often. The biggest problem with MSDs is that their origin can be really hard to pinpoint. There are a lot of things that lead to the development of these disorders, and because they develop slowly over time, it can be hard to link them to one single task or motion. For example, the motions involved in typing are similar to those involved in playing the piano. So while things like cuts, scrapes, and broken bones have a direct and obvious cause, injuries like MSDs don't usually. So that being said, what are these causes of these MSDs? What are the ergonomic risk factors that can progressively contribute to injury without us knowing? In terms of physical ergonomics, there are 7 risk factors that we worry about. Depending on a person's health, genetic, age, lifestyle, and some other personal factors, these risk factors will all affect different people with varying degrees of severity. Not everyone will sustain an MSD from doing a job incorrectly, even if they do it that way for many years. On the other hand, other people might experience an MSD after only 1 day or 1 week on the job. And then there are also some other risk factors and confounding elements that deal more with these interpersonal issues or problems or with mental processing during a task. And research has shown that mental health, not so much the clinical mental health that we often talk about, but things like job satisfaction, support from management, stress, cognitive demand, burnout, those types of things, will also affect the way you feel physically. People have been shown to report higher levels of pain when their cognitive health is not up to par. This means that by controlling for cognitive risk factors too, we can actually prevent or reduce the impact of physical risk factors. Now, I'm not going to go into any more detail about cognitive ergonomics and psychosocial risk factors in this presentation. There are a lot of them to consider, and those things are harder to identify. They're usually addressed more at the system or organizational level. Physical risk factors, on the other hand, are things that we can all watch for. So the 7 physical ergonomic risk factors are awkward postures, repetition, forceful exertions, duration, static work, environmental conditions, and vibrations. If we can mitigate these risk factors in some way, then the job will be safer and easier to do. So let's talk a little bit about each of these so that we all know what to watch for. Awkward postures are any posture that takes your body outside of its comfortable resting position. Think about the position you would assume if all of your muscles relaxed and your body went limp. Now, obviously, this doesn't make any practical sense, especially in an occupational setting, since it's impossible to do anything in that situation. So practically, what we try to promote in ergonomics is what we call a neutral posture, which just means that as many muscles are relaxed as possible. Typically, this means that your head is stacked over your shoulders, your back is straight and upright, centered over your hips, and your legs are straight but relaxed, with your arms hanging loose at your sides. Again, this doesn't really allow for much activity, but it's what we're trying to promote as much as possible. Neutral postures minimize the effort required in any given position, which then reduces the strain that's placed on our joints. So as you can see here, a slouched posture causes neck compression, and the greater the slouch, the greater the strain. In fact, the further we move any joint from its neutral position, the more strain is placed on that joint, and the harder the task is to complete. This applies to every joint in the human body, whether you're reaching for something that's an arm's length away from you, whether you're bending over to pick something up off the floor, or whether you're just looking down at the cell phone in your hand. So what can we do to control for the risks caused by these awkward postures? Always try to stick as close as possible to your neutral posture, with your joints relaxed and your arms close to your body. Whenever possible, keep your joints straight. And when that's not possible, bending a joint to 90 degrees or so is okay, as long as it's supported, like when you're sitting at a computer, for example. Now, I'm not an unreasonable person. I know that even that isn't always possible. So the most important thing to remember here is that if you do have to adopt some awkward posture for whatever reason, like getting decorations out of the crawl space or picking things up off the floor, just limit the amount of time that you do it and take breaks frequently to reset from that awkward loading. So that was posture. The second risk factor is repetition. Repetition is doing the same thing over and over again. It doesn't matter what you're doing. Even small, safe movements can add up over time. Think of it like a rope fraying. Eventually, it wears down to the point where it snaps. Now, don't worry. Tissues in the human body don't usually snap, but this fraying is what we call those repetitive strain injuries we talked about before. Those injuries that are caused by repetition. Fortunately, reducing the risk caused by repetition is easy. Just change up what you're doing once in a while, stretch, and take frequent breaks. Next on our list of risk factors is forceful exertions. This could also be called heavy lifting or having to do something beyond your physical capabilities. This one's really common sense, right? If you lift something that's too heavy, you'll get hurt. We all know this. It only takes one time. If we stick with our rope analogy, this would be if something pulled so hard on that rope that it snapped instantly. Now, again, tissues in our body aren't likely to snap like the rope. Instead, we see things like muscle strains or that feeling of a pulled muscle, which can be quite severe and debilitating depending on the forces and the tissues involved. The problem with forces is that they aren't as straightforward as they seem. It's not just about how heavy something is, although that is definitely something we watch for. A lot of different factors will affect the amount of force that is exerted on the body. We talked about posture already, where the further an object is from the body, the heavier it feels. Well, that means that the force experienced by the body is higher if an object is further from the center of the body. Posture isn't the only thing that will affect how far an object is from the center of the body, though. The shape and size of the body can also influence this. Think about pregnancy or weight gain around the midsection and how it might influence how close you're able to hold an object to your body. Lastly, the speed of the movement is something that we have to consider too. Have you ever thrown out your back by picking up something light like a pencil off the floor? Or tweaked your neck by doing something simple like looking over your shoulder? It likely happened because you moved faster while doing so, which made the weight of your body itself feel that much heavier. The best thing to do to limit the risks associated with these forces is to just be conscious of how you're doing something. Watch your posture and the way you're manipulating an object. Be aware of how you're moving and the speed at which you're doing so. And if something is too heavy for you to pick up safely, either reduce the weight or ask for help. Another risk factor to watch out for is the duration or the length of the exposure itself. This can be the length of your shift, it can be the number of years on a job, or it can be the amount of time spent doing any one task. Basically, if you increase the length of time that you're exposed to any hazard, you increase the risk associated with it and the likelihood of it causing injury. As you can see here, research has shown that the length of a shift directly correlates to the risk for injury. In fact, jobs that require overtime hours are associated with 61% more injury risk than those without overtime hours. And it's not just because these jobs are inherently more dangerous. They aren't necessarily. In order to reduce the risk associated with duration, break up the time of the exposure. Use a job rotation schedule to make sure you aren't doing any one task for a long time, and take frequent breaks to help break up the time spent. For example, if you've been sitting down for a while, stand up, or vice versa. Equally important is to spend less time doing the most hazardous tasks. As shown on the graph here, the heaviest lifting should be done for the shortest amount of time. When considering these risk factors, we also look for things like static work. Static work is also known as stationary work, where one posture or position is held for a long time. We've all experienced the pain or numbness that goes along with holding your hands up over your head for a while, or when your legs go numb after sitting for a while. That's what I'm talking about here. This often goes hand in hand with small repetitive tasks that use the same muscles for a long time. To correct for this risk factor, it's basically the same thing that I've been saying all along. Just take breaks and try to reduce the amount of time that you spend in that position. The last two risk factors are things that I'm going to skim over pretty quickly. These include environmental factors and vibrations. So part of ergonomics is really just making sure that people are working comfortably. Workers will be at their most productive when they're in a comfortable climate. That means ensuring that the work environment is neither too hot nor too cold, too bright nor too dim, too noisy nor too quiet. Most of these things are extremely subjective though, and what one person finds too cold, someone else will find too warm. So that's why it's important to have accessories on hand to help correct for these things as needed. Fans, space heaters, light and glare filters, noise-canceling headphones or white noise machines all help people to customize their work environment along their own personal preferences, helping to make sure that they can be as productive as possible. Vibrations typically occur in the hands and arms because of handheld tools, like the jackhammer shown here. But we also have to watch for whole body vibrations, like those seen in heavy machinery operation, like when driving a truck or tractor or a bus. Vibrations in the hands and arms can affect blood flow to the fingers and leave the hand cold and white. Whole body vibrations displace fluid from the discs in our spine, contributing to disc degeneration and spinal injuries. When it comes to vibrations, our best bet is just to try and reduce the vibrations as much as possible by taking breaks frequently, selecting a better, more well-insulated tool, increasing the shock absorption in seats or flooring, and when none of that is enough, wearing shock-absorbing gloves and other PPE as needed. So those are the 7 physical ergonomic risk factors that we watch for when we try to keep people safe. I know that there was a lot to that and that I covered it pretty quickly, but it gives you a bit of an example of the complexity of this area of inquiry. As ergonomists, we have to consider the person, the context, the task, the situation, the environment, and the interactions of all of these elements with each other. The number of things to think about at any one time is endless. But as an ergonomics researcher, that's where I get excited. These interactions between people, situations, and contexts constantly have me coming up with new questions that I can't wait to answer. So that's how I like to define my research program. I picture myself in the intersections of all of these things we've talked about so far. I like to focus on the areas that most ergonomists don't for whatever reason, either because the research affects fewer people by focusing on a smaller sample of the population, or because the context is transitional and doesn't last very long, or because there's no real easy or straightforward way to get the information needed. So let's talk a little bit about how I like to come up with different ways of looking at different people in different settings. But I realize that that definition of my research focus isn't really saying anything and won't likely get me any grant funding. So I tend to break my research focus up into 3 categories. That is the different who's, the different where's, and the different what's. So for the different who's, I'm interested in looking at population groups. This isn't really novel in ergonomics. Researchers will often compare healthy versus patient populations or males versus females. For me specifically, I like to look at people as being somewhere along a spectrum in their lives. And while progressing along that spectrum, each person will undergo changes that are just a natural part of life. So because these changes are normal and progress relatively slowly, we don't normally take them into account while we're working. For example, aging leads to increased tissue stiffness, decreased range of motion, and decreased strength. But when does this happen? At what point does it affect a person's ability to work in the same way that they've always worked? And is there a point in life that we should look at changing the way that aging workers are working? Pregnancy also brings progressive changes, although these are more short-term than something like aging. Pregnancy increases the flexibility of all tissues in the human body and changes the woman's weight distribution significantly. So, what effect does this have on her ability to work the same way as she did before she was pregnant? Progressive illness and disability, including things like Parkinson's, chemotherapy treatment, and diabetes, as well as significant weight gain or weight loss, also bring changes in a person's strength, their range of motion, their weight distribution, and their tissue stiffness that can all affect a person's ability to do their job safely. But again, these workers don't normally account for these things until they absolutely have to. Remember what we talked about as far as load positioning and the effects of pregnancy and obesity on how close to our bodies we can hold a heavy object. If we don't consider these factors until we can no longer move in the same way as we did before, it may already be too late and the person might have started developing a debilitating injury. For the different wheres, I also like to look at different work settings. Right now especially, I've shifted my focus to people working from home and the impact of non-traditional workstations like working from the dining room table or the couch, or trying to get anything done while kids, pets, and chores are all demanding your attention. I'm also looking at comparing worksite wellness interventions in different job settings. Do stretching and exercise programs or break recommendations work the same for office workers as they do for assembly line workers? And I like to look at changing the way the same job or tasks are done. So looking at sitting versus standing for office work or for playing video games, or sitting versus standing for assembly line work. I also think it's important to look at the mental side of ergonomics and its effect on physical health. I'm just getting into this area, but I have a student looking at the interaction between stigma, discrimination, and job satisfaction with pregnancy-related pain in police officers, which we think is pretty exciting. A lot of physical ergonomists ignore the mental demands that a job requires and only focus on the forces and physical risks associated, which is what I've always done in the past. But we can't ignore the brain-body connection and the effects that these two things have on each other. For the what's, this is mostly my methodological approach. I like to take methods that have been published before and see if I can repurpose them to get some new, meaningful data in a different population or context. This could mean combining methods that sort of hint at a similar variable and looking at that variable from different perspectives. Here you can see 3 different ways that I've used to measure a person's stiffness, which, as we already discussed, has been shown to change with age, pregnancy, and disease. But until I started doing it, none of these tests had ever been used in aging, pregnant, or chronically ill populations. I've also recently had a paper published that looks at ways of quantifying a person's age based on their fitness level. That way, when we do an aging study, we don't just have to compare people based on their date of birth. Not all 60-year-olds have the same working capacity, and it's important to consider what they are physically able to do on an individual basis. I also have a student currently looking at gender on a sliding scale, rather than just the binary way that science and technology fields usually look at sex. We know that gender is fluid. That is widely accepted. But I think that this gender fluidity can affect some ergonomic variables that we really only associate with male or female. We've really only just started this inquiry, but I'm really excited to see the results. And given the nature of things right now, I'm having to figure out how to do all of the things that I normally do, but to do them virtually, either through video consultations and assessments or through surveys. So that's also a new methodological way of looking at things, especially for me, although all ergonomists are dealing with this problem right now. And then there's the intersection of all of these things. Different people working in different places. Things like, does working from home affect older workers differently than younger workers? And can I look at different people in a different way? So using the adjusted fitness age that I mentioned and the sliding sex scale in all of my ergonomic studies. And where most of my time has been spent recently, using surveys and virtual assessments to look at people working in different settings. And I think there'll be the opportunity to put all of these things together and look at functional age or gender fluidity in different workstations using a different methodological approach to data collection. So I think that's really fun and exciting too. So that's my research in a nutshell. Different ways of looking at different people in different settings, and what I see as the importance of these considerations. Thanks so much for listening. I look forward to continuing this conversation and to answering any of your questions.